This
volunteers.
conference will now be recorded.
So a special thank you to our chairs for sharing their time and talents with us and for helping out. Um, just a brief overview, Partners in Giving is comprised of over 500 charities through 11 state, national, international umbrella groups, and $81 million has been raised since 1973. So last year, the overall campaign raised nearly $2.5 million. And again, that is because of your investments, your kindness, and your generosity. Through this, we are stronger together, and when we succeed, we're all better for it. This year, the need is literally greater than ever. So I'm going to ask that you please each consider donating this year and dig as deeply as you can. We have giving.wi.gov where you can make your pledge, and I will put the mobile cause app in. We have a suggested donation for this event of $5. So thank you all again for your time and generosity. And let me introduce our speakers. Today we have Jaya Larson, from Commonwealth Development. We also have Jonathan Hansen. He is here from the Hunger Taskforce, and Ben Johnson. Ben is from Agrace Hospice. So we'll start with Jaya. She is the Communications and Fund Development Coordinator for Commonwealth Development. And Commonwealth Development works to serve the foundational bedrock of healthy community and economic development in Madison. They have projects that are aimed at improving housing and the business climate of the neighborhood, and they use a people-centered approach on racial equity and community level health improvement. So welcome to Jaya.
Hey, thank you so much for having me. I've never done one of these before, so bear with me. So yeah, Commonwealth Development, as you just heard, we were founded in 1979, and like Donna said, we have 4 main areas. So we have housing, we have small business support, we have workforce development for youth and adults, and then health equity and violence prevention. So we're most known for our housing support. We currently have 146 affordable units of housing throughout Madison, with 11 more being built on the west side. We also have a lease to purchase program for families. When I started last year, there was a great emphasis on building working relationships with other programs in Madison, so we could reach a wider range of people suffering from homelessness and other related social issues. So we partnered with organizations such as the Tenant Resource Center, YWCA, Department of Workforce Development, and the Salvation Army, and those are just to name a few. And collaboratively, we worked to house adults. We call them adult youth, ranging in age 18 to 25, single mothers, single fathers and families that have been homeless in shelters for more than 6 months or more. Last year, 65% of our resident households were at or below the 50% AMI for Dane County. So we really work to support those individuals, the people, we always say the people who are taking care of your children and taking care of your parents. The people who, without them in our communities, we wouldn't have healthy foundations. So we really work to support those people. To another extent, we have the workforce development area where we have adult and youth programming. So our adult programming has, 2 different programs. Our first is the Job Shop. And this is a voluntary service where social work professionals and volunteers offer face-to-face, one-on-one support for people trying to find work. So we call this the front door to a caring environment for helping people in their employment seeking needs. So people can take advantage of this to the degree in which they choose. We also have our STEP program, which is the Southwest Transitional Employment Program, and this is paid short-term work. So STEP is designed to connect people in the community to short-term paid employment experience. We provide individualized support and connections with other volunteers. So eligible participants are hired and are employed by Commonwealth and are paid a living wage while working temporary positions that are designed specifically with the participants' employment goals in mind. So as I had mentioned, we have that one-on-one support, and a really critical piece of the STEP program is the case management support. So each participant, based on their own goals, their own experiences and skills that they have, work with a case manager and work on resume development. They work on weekly tailored job leads and are connected to area employers that have partnered with our efforts in the past. So a really cool part about STEP is that participants have seen their average monthly income increase from around $780 to a month to over $2,400 a month, just by going through our program. And this is a really unique program in that many of the people that we work with have been either out of the workforce for 5 or more years, haven't been in the workforce at all, or previously incarcerated individuals who've just been released and they're looking to rejoin society and make a positive impact for themselves and their community. We also have the youth program for workforce development, and this has 4 different areas. So the first is Wanda Fulmore, and this is partnership with the City of Madison to provide roughly 30 teens each summer the opportunity to work paid internships with various departments in the city. So this really aims at diversifying the City of Madison's staff to more accurately represent the people who live and work in Madison. And the program's namesake, actually, Wanda Fulmore, she grew up in Madison and spent her career as an employee in the mayor's office. And so this program was initiated by Mayor Paul Soglin. Wanda Fulmore interns, they work for 8 weeks. They receive mentoring support from Commonwealth staff. They complete professional development sessions, are coached based on feedback communicated from the city back to Commonwealth staff. And it's really a unique opportunity for Madison youth to form valuable connections, gain exposure to different career paths, the obvious boost their resume, but most importantly, represent the voice of the Madison youth. We also have the Youth Business Mentorship Program, which we call YBMP, and this has several different components, very similar to Wanda Fulmore in that they are partnered with a professional and build a mentored relationship. We also have the PEAT program, which is part of this YBMP program, and this is a project-based learning opportunity, which we started in 2018. And PEAT, which is the program for entrepreneurial and agricultural training. If you asked me to say that 5 times fast, I could not. I could barely say it once. So it's 9 students who participate in an urban agriculture food systems training, and they learn about what it takes to run a business, the details of food systems, urban agriculture, and a lot more. We also have financial literacy and employment skills trainings. So students it's a pre-employment training workshop, and it helps students kind of go through resumes and build those skills. They have mock interviews to learn how to answer questions, and it works on boosting the confidence of students who are going into the job market. We also have a financial literacy workshop, which is increasingly important considering that many schools don't have home ec or any required, financial courses anymore. And so this really helps youth understand how to maximize their paycheck once they start earning it. They learn the basics of saving and budgeting, and it helps them understand the financial institutions and big mistakes to avoid, especially as they go into higher paying positions. We also have our small business support. So we have 2 different levels of that. We have Madison Enterprise Center, which is our first stage business incubator. And this is for businesses who are just starting, serve up expanding small businesses, and they can stay at MEC for 3 to 5 years. And then from there, they can transition to, or other businesses come in at this point, a second stage business incubator, which continues to serve those startup and expanding small businesses, and this is called Main Street Industries. And lastly, I say lastly as if I haven't been talking for the past 10 minutes, we have our violence prevention and health equity program. So that's currently CBCR, or community-based crime reduction program, and that was through a department grant, and it's transitioning into what will now be called SMAC, which will be the Southwest Madison Action Coalition, and it is actually led by a retired Madison Police Department officer. And this project's goals really are to create a durable framework to support grassroots leadership and social cohesion, to build trust and collaborative problem solving among police, residents, and community groups, which is more important now more than ever, considering what we have all seen over this, these last several years. Working on improving affordable housing through code enforcement and nuisance abatement, and finally enhancing job training, employment, and entrepreneurship opportunities to expand access to substance abuse and other wellness services, to provide alternatives to first-time and nonviolent offenders. So I will stop talking now. Does anyone have any questions?
Any questions? Thanks so much. Yay. All right. Our next speaker is Jonathan. And Jonathan Hansen is the Director of Development for the Hunger Task Force. He, along with his team, focuses on building a strong community partnership with other agencies, also delivering donor stewardship and securing resources that Hunger Task Force needs to end hunger. So welcome, Jonathan.
Thank you, Donna, and thank you to everyone for having me here today. It's really great to be here, and I just wanted to start by, again, thanking you all for your great past support through this campaign, and I hope you guys have a really great campaign this year. So best of luck. Thanks so much. My name is Jonathan Hansen. I'm the Director of Development at Hunger Task Force in Milwaukee, and I am also the volunteer administrator for the Hunger Relief Fund of Wisconsin. And the Hunger Relief Fund is a federation of over 20 different organizations throughout Wisconsin that are all unified in their effort to feed hungry families and end hunger in their local communities. Obviously, the pandemic has had a tremendous impact on hunger relief across our state over the last 7 to 8 months. Speaking from Hunger Task Force's perspective here in Milwaukee, we have seen upwards of 30% increase in local need at food pantries and meal programs. We typically deliver about 9 million pounds of food a year as an organization, and this year we distributed 13 million pounds, nearly 30% increase, which equated to about 78 full semi-truckloads of food, more than we did during the same time last year. We know that while the pandemic lingers, that need is going to continue as we get into the cold Wisconsin winter months. We have folks who are on unemployment and those benefits are starting to run out. We have kids and families who are in virtual school and learning settings that are away from their traditional school meal programs. And Hunger Task Force and fund members are anticipating that as we get into those cold Wisconsin winter months, that we're going to see needs start to spike again. So there is great need in our community right now. And the one or two things actually that I wanted to impart with everyone today about a gift to the Hunger Relief Fund is that, one, your gift is going to go directly to the organization of your choice, and it's going to help them purchase food. It's going to help them support their operations, support any kind of PPE needs that they might have, support their staff. It's an unrestricted gift that can help these organizations in whatever way is best for them at the moment. And number two is that as the fund administrator, Hunger Task Force absorbs all of the admin costs for the Hunger Relief Fund. So know that 100% of your gift is passed through to the organization of your choice and helps them to end hunger in their local community. So thank you again, everyone. I hope you can make a gift to the Hunger Relief Fund and that you have a great campaign. You guys give generously, and I appreciate you taking the time to listen today.
Thanks, Jonathan. Does anyone have any questions?
Would you repeat that figure on the tonnage of food that, was that for this year or?
Correct, that was for 2020. Since the pandemic started, Hunger Task Force in Milwaukee has increased we've seen 30% increase at local pantries, and we've also increased our food distribution by 30%. And the figure was about 3 million pounds more than of food at the same time last year. So that equates to about 78 full semi-truckloads of food that we have delivered from March until this time.
Thank you.
You're welcome.
All right, and now we have Ben Johnson from Agrace Hospice. Ben is the outreach manager for Agrace Hospice, and he has a background in the hospital and healthcare industry. He currently promotes Agrace's programs, including hospice and palliative care, grief support, and age at home, which is their non-medical home care. So welcome, Ben.
Thank you very much for having me. Um, and so I'm going to try to share my screen. Can everyone see my screen right now?
Yes, I
Perfect.
can.
Perfect. I will still, for those that can't see it or calling in, I'll still talk through everything. So again, my name's Ben. I'm the outreach manager here at Agrace. And for those that aren't familiar with Agrace, Agrace was founded back in 1978, and we are Wisconsin's largest hospice, as well as the largest nonprofit hospice organization in Wisconsin. Currently, we're serving over 17 counties, and that includes offices in Madison, Janesville, Baraboo, and Platteville. And right now we are serving anywhere around 950 hospice patients per day. And we do that with the support of over 900 volunteers. We are also affiliated with both UW Health and Unity Point Meritor. So first, the main service that a lot of people think of Agrace is with hospice care. So to talk about hospice, hospice is a blend of medical, emotional, and spiritual care. And the other thing to know is that this is for people of any age who are dealing with a life-limiting illness that have a life expectancy of 6 months or less, when their primary goal is going to be comfort, not cure. And so with our hospice care, our care comes directly to you. So whether somebody's living at home, they're in an apartment, or they're in a nursing care or assisted living center, we come directly to them. And some things when people are, one of the common questions we will hear, whether it's from family members, spouses, even healthcare professionals, is when is it the right time to call Agrace? And so some key identifiers that we share with individuals is, if there's an obvious weight loss, if somebody is maybe having frequent visits to the emergency room or hospitalizations, somebody who's also having lots of falls, as well as uncontrolled pain, and then somebody that's also needing help with most daily activities, such as eating, skincare, bathing. So with that, when somebody is enrolled on hospice, we're going to provide visits to them from our Agrace medical team, which will include our hospice nurse case manager, a social worker, CNA assistants. We have a spiritual and grief counselor and a physician on each of our teams. We also then will help with medical care and medicine that is related to your hospice diagnosis. We also have our own durable medical equipment company. So if somebody is in need of a hospital bed or a wheelchair or a lift, that's something that we are able to supply. We also offer short-term inpatient care. And then as what my main role is really about education, and so we are working to educate facilities, families on what to expect, as well as the patients themselves on what to expect with their prognosis. One of the big questions we get is who pays for hospice care? So majority of our services is paid for through Medicare or Medicaid. You'll see that it's upward of 90%. Otherwise, if somebody is not in that Medicare, Medicaid window, somebody that maybe is under that age, that's where private insurance would come in. But then if somebody falls in between the cracks there, that maybe they don't have a private insurance that covers hospice, and maybe they aren't with Medicare, Medicaid, we have our own foundation, which is the Care for All. And so most of our patients will see very little out of pocket costs, and we will not turn anyone away for hospice care due to finances. And so one of the things I mentioned there, and something that a lot of people will identify with Agrace, is our inpatient center. That we have one here in Madison, one in Fitchburg, one in Janesville. And people ask, like, what goes on in those facilities? And so, Here we have, it's what's called inpatient hospice care or general inpatient, and it's for treating serious or complex symptoms. So the main goal for our facilities is to really control symptoms and then have that person return back to their home. So whether that is going back to their home, their assisted living, their skilled nursing facility, if we can control those symptoms, our ideally goal would to get them back. In order for a person to come here, they do have to be medically necessary. And again, all of our services provided here are covered through Medicare and insurance, as well as our foundation. And so here's just a couple pictures. This is our Madison inpatient unit, which is located, we say Madison, it's kind of borderline between Madison and Fitchburg. And then we also have one in Janesville. And COVID, let's talk about that and how that's changed. Because as I mentioned, a big part of our hospice program is coming directly to the individuals. So, while, we absolutely, from day one, we continued to admit new patients and serve hospice patients, including those who have COVID-19. Our staff are all screened twice daily, and we always use proper PPE, whether that is the full like face shield, N95, like a face mask, booties, hand, gowns and everything. We are making sure our staff are safe, and that that has been something that we have been doing since day one. All of our staff that are working within skilled nursing facilities are also tested for COVID at least weekly, and it varies. It's going to vary per county, and this is one thing that has been a challenge for us is, with us being over 17 counties, I think it's the Department of either DHS or CMS has will give us or give skilled nursing facilities testing frequency rates based on their counties. And so some counties might be needed to have all staff tested twice a week. Some are every other week. And so that's where Grace came in and said, we will do this weekly testing. And then if a county does have a spike where we are needing to do more frequent tests, those care teams are able to do that. Another big difference that we've done is many of our visits, we are definitely trying to limit that in-person interaction to keep people safe. So mainly right now, you're going to be seeing visits through our RN case managers. Sometimes where it's allowed and it's helpful, our CNAs are also coming in there. But the rest of the team, a lot of that work's can be done remotely, doing things like this, whether it's, I say FaceTime, but we use Zoom and Teams to talk with families and facilities where we can all get together. And then here at our IPU, we are admitting patients who have COVID-19 in Madison. And we still allow visitors, but all visitors must be screened and are needed to use proper PPE when they are here. So somebody will, says like if they maybe are interested in hospice, but then realize, this isn't right for me or I'm not quite there yet. That's where we have our palliative care program. And here, palliative care is the support of care during a serious illness. It's available at any point in that illness while somebody is even continuing to seek curative treatment. And the focus there is on quality of life, such as physical, emotional, and social. And again, palliative care is majority of that's going to be covered under Medicare Part B. So the goals of palliative care are really to address those poorly controlled symptoms. We're going to prevent or relieve suffering, maximize comfort. We want to really help improve function, independence, and provide the best support possible to get that quality of life for the patient and their family. So for palliative care, this is mainly going to be for anyone who has a serious illness or chronic disease, such as Alzheimer's, cancer, COPD, CHF, ALS, Parkinson's, somebody that's maybe had a stroke, or any other rare illness. Here, another big thing about our palliative care program is our providers come directly to the person. So instead of going into a doctor's office and spending anywhere from 15 to 20 minutes with your physician, our providers will come directly to you, and they will spend anywhere from an hour and a half to 2 hours with you. They're going to discuss symptoms, medications, what your goals are, what challenges you're having. And then what we do is we make recommendations back to the physician about that. And that's where we work collaboratively with your primary care physician or the physician of that disease for that. We do offer follow-up visits if necessary. And then here, what has changed with this since COVID? So initially off the bat, we went directly all virtual. And where that was kind of like you might see this with your own physicians where you're able to, meet with your physician through FaceTime or Zoom or something like that. And now we've kind of gotten back into the swing of maybe doing a little bit of a mix. So some of our visits might be virtual, some of them are going to be in person. Where we also have some opportunities is where we have 2 geriatric psychiatrists that are on staff. And instead of having them maybe go into a facility to talk with somebody that's maybe having some difficulties with behaviors or things like that, we can have a nurse practitioner or an RN case manager in there. And that's when they can, pull out their phone and have a virtual conversation with our physician, the nurse at that facility, as well as the patient and their family. As mentioned before, we also have Age at Home, which is our non-medical home care organization. And this is going to be more or less care for somebody to help with like personal care, meal preparation, talks about can do light housekeeping, help with just some easy cares around the house. It's a great service, and it's just nice to have something like this to help out with those seniors. The Age at Home service area is kind of up in that greater Sauk area, as well as all of Dane County. We also have our Spiritual and Grief Center, and this is a standalone facility in Fitchburg. And here it's a freestanding location where it is just for grief support. It's going to be geared for adults, teens, as well as school-led children. And so you'll see some pictures here. We have some rooms that there's a teen room where it's a little bit more comfortable. It's not going to feel like a facility or going into an office building or anything like that. And we do offer support groups. And right now, a lot of these support groups are done virtually, and we are able to still offer that one-on-one grief support. As mentioned too, we have over 900 volunteers that help our organization year round. And something that we always find interesting, is that if anybody's ever interested in volunteering, we are very flexible with our schedules. We offer free training. And a lot of our volunteers, and I think this is something to note, you don't need to be somebody that's gonna be, we do offer that patient care companionship, but you don't have to have that direct contact if that's not something you're comfortable with. We do have other volunteers that help out with office and administrative events. We have volunteer baristas, people that help with our flower decorating. We even have people that help with our gardens in both our facilities. And then we also have our thrift stores where we have those all located in the Madison as well as Janesville. And those are also staffed by volunteers. And here, the proceeds of this help support that Care for All foundation that we have for our hospice care. And it's pretty neat just to see the stuff that we are able to, have that people donate to us. And it's always fun just to kind of see, the interesting things that are donated to our organization. So are there any questions about Agrace? All right, well, thank you very much for giving me an opportunity to talk with you all.
Thank you.
Well, thank you all for coming today. I do want to open it up one more time for questions, if anyone has any for any of the speakers. Any comments? Can always put something in the chat. But thank you all for coming.
Yeah, I have a question about the Agrace. How far north do you go again? Just was wondering.
Yeah, let me look here to give you a specific. I know it's way up there. We go all the way up to like halfway up into Adams and Juneau County.
Okay.
So like Adams Friendship, that area, Westfield, all the way over to like you know, like, I don't know, some of the Elroy up in that area. I know we're up at that. Is there a specific area you're wondering about?
Well, yeah, a little further north. I was just wondering, yeah, about that. But thank you.
Yeah.
Anyone else? Well, thanks again to our speakers for coming today, Ben and Jaya and Jonathan. I have a link in the side to their organization's websites, also a link to the Partners in Giving booklet, so you can check out our other 500 organizations and agencies, along with our umbrella groups. And please remember to pledge this year. We really appreciate all that you're willing to do and give this year, especially since times are so hard. So thanks so much. Everybody have a great day.